name is Rosalind DeLisser, and I am an associate clinical faculty in the School of Nursing. The big part of my job is in education and program development, design, and leadership. So I have been the co-director of the psychiatric nurse practitioner program for a number of years, and just recently designed a new curriculum in collaboration with UC Davis and UCLA schools of nursing to build an online postmaster certificate program. And then the smaller part of my job is my clinical work. And I do a day, sometimes a day and a half a week of psychiatric and substance use treatment for women with HIV at the UCSF Women's HIV Clinic. I actually grew up on the island of Kauai and was really in this very sort of tiny community with very few resources, and wasn't reading and was having a difficult time learning and was having all these challenges. And it wasn't until I got some sort of more individualized help and support that I came to find out that I was struggling pretty intensely with ADHD. And it wasn't that I didn't want to learn. It wasn't that I was, wasn't capable of learning. I just needed to learn in a different way. And I need things to be a little bit more tailored to me. It wasn't until I was in therapy a couple of years ago that I began to realize the depth of my workarounds and how those workarounds were just part of my day, but ultimately contributing to, this sort of extra above and beyond workload that other people aren't carrying, that I just do because it's what I've always done. It's how I've learned to manage my environment. I wish I could say that medication was the fix all do all, but it just isn't. And so, I use all of my tools that I can, but ultimately it's upon me to ensure that I stay focused. Part of my ADHD is that I also have a tremendous amount of energy and a tremendous amount of drive. And so I hold myself to this super high standard because for so many years I failed. I failed in comparison to my peers. And so I definitely push myself above and beyond. And, in the academic setting, that's meant speeding through promotions and accelerations and up for full professor and all these great things and teaching awards, and all that's great. I didn't have a whole lot of that strong messaging when I first started. And so I took it and ran with it. And so I've had to learn to dial back and to say no, and that saying no doesn't mean you're a failure. I think that's a big thing for us who've been clinicians for a long time and come into faculty roles. I'm used to performing with patients, right? And performing based on my billing and my coding and all that good stuff. And in the faculty world, you don't get that immediate return of your patient doing better. They're coming back, they're engaging. Instead, it's this sort of entrepreneurial landscape of just do. But I think that in our environment today with COVID-19 and budget cuts and challenges that are unbeknownst to us today, I wish that competition could cool out. I wish we could just be okay with what we have and who we are without trying to be more, bigger, better. Because I think it would really promote our well-being. I think as individuals, we all bring something very special to the world. And in healthcare, our individual style, our individual personality, and the relationships that we build as individuals is what makes us who we are. And, people talk about UCSF as, it's all about the people. And I would agree, it is about the people. And I think that a big part of that is because you bring a bunch of amazing people together and you build relationship together, and it's pretty magical. And in that is the human experience. And so I think that we sell ourselves short for not appreciating our full identity, right? And I know that now it's, we've moved to our gender identity. I know that we are really trying hard to move our entire educational system to an anti-racist, anti-colonialist foundation and philosophy. And I appreciate that, and I'm loving doing that work. And I don't want us to lose sight of our individual identity for all that it is. And that means our identity as an individual living with a mental illness, or a physical illness, or a family member with an illness, and how that identity then enriches these amazing, magical relationships. We are brought together for a reason, and those identities are what make us unique. We've got some big work ahead of us to try to figure out what it means to be kind to one another, and what it means to kind of put aside the competitive agenda for a minute and instead appreciate one another and see each other for who we are. I think that we all need support. And so my piece of advice for folks who are struggling is, you got to get help. And to know that there's no shame in getting support and getting help, and that suffering alone will only make it harder for you, more painful, more suffering. And to allow someone you trust in to find you the resources, or to connect you with resources, or to be that resource, is so important.